So I think when we speak about breast cancer patients with brain metastases, we need to, speak about HER2 positive breast cancer separately from the rest. Actually, for HER2 positive breast cancer, we have a lot of very good HER2 targeted drugs. A lot of them have in fact shown to have some activity also in brain metastases. And we recently had data from the HER2 CLIMB study with Tucatinib, which in fact included patients with active brain metastases and showed that there was a survival advantage for patients with breast cancer brain metastases receiving Tucatinib in the trial. So there, I think we have a lot of very good drugs. So there might be a rationale to, further target the HER2 pathway in these patients. It's completely different, I think, unmet need is that of HER2-negative breast cancer patients with brain metastases. In this case, in fact, we are mostly limited to using chemotherapy, and we have not so many targeted agents. We have some data, however, about activity of CDK inhibitors in breast cancer patients with hormone receptor positive brain metastases, and we have some data, not so much, for using PARP inhibitors for these patients. But these patients were not included in the trials with active brain metastases, as was the case on Tucatinib, so we need to collect a lot more clinical data from real world to really understand if some of these agents work better. I think considering a pipeline, the development of PI3K inhibitors, which, as I was saying, the new PI3K inhibitors which crossed the blood-brain barrier, I think they are very good agents to study in the future in these patients. Also because there have been some small study reporting that potentially PI3K mutated breast cancer patients, hormone receptor positive, HER2 negatives, develop brain metastases more frequently than the PI3K wild type subpopulation. So potentially these population of PI3K mutated breast cancer patients would be in fact enriched in patients with brain metastases. And I think that's a very interesting point. And then we have some data toward the development of antibody drug conjugates in these patients as well.